Picture this. You are a man who wants to make your partner feel loved, wanted, and comfortable. You have been together for years. You think you know what she likes. You slow down, try to be attentive, and believe you are doing everything right. Yet, something still feels missing. She seems distracted, less responsive, or not as connected as you expected. Now here is the question that can change the way you think about intimacy. What if the most important part of foreplay begins before touch even starts? Many couples are never taught this. They learn about intimacy as if it were a performance, with a right sequence, a right technique, and eventually an outcome. But real intimacy is more personal than that. What feels wonderful to one woman may feel uncomfortable or uninteresting to another. And what worked beautifully 10 years ago may not feel the same today. That becomes important after 50. As we age, our bodies, hormones, medications, stress, sleep, relationships, and expectations can change. For women, menopause and other health changes may affect comfort and sexual response. For men, changes in confidence, erections, energy, or health can create pressure. None of this means intimacy has to disappear. It means assumptions may no longer tell everything. And this is where men make a mistake. They focus on doing more, when the better answer may be paying closer attention. Think about the difference between performing and connecting. Performance asks, "Am I doing this correctly?" Connection asks, "How is my partner experiencing this?" That shift can change the atmosphere between two people. In this video, we are going to explore what can help a woman feel comfortable, emotionally present, and engaged during intimacy, without pretending there is one secret that works for every woman. We will also look at common mistakes, changes, communication, and when a change deserves medical attention. Because the answer may not be another technique at all. But before we get to what matters most, we need to understand why the same approach can work beautifully for one couple and completely miss the mark for another. There is something important to understand before we go any further. There is no single secret that works for every woman. If someone tells you there is one technique, one touch, or one guaranteed method that will always create the same response, be cautious. Sexual response is personal. It can be influenced by physical comfort, emotions, relationship quality, stress, sleep, medications, hormones, health conditions, past experiences, and simply what a person prefers at that moment. Two women can have completely different experiences even in similar situations. And there is another factor that becomes especially important in long-term relationships: familiarity. When you have been with someone for many years, it is easy to think, "I already know what she likes." But people change. Bodies change. Circumstances change. Preferences can change too. Something that felt comfortable years ago may not feel the same today. Think about intimacy like a conversation. You may know the language, but that does not mean you should stop listening. Imagine talking to someone while never noticing their expression, tone, or response. You might be speaking perfectly, yet completely missing what they are trying to communicate. Intimacy works in a similar way. Instead of asking, "What am I supposed to do?" a better question is, "How is my partner responding, and what is she telling me?" That does not mean turning a private moment into an interview. It means becoming curious again, together. A simple question, a pause, or paying attention to comfort can communicate something powerful. Your experience matters to me. And this is the principle behind the secret we are building toward. It is not a magic technique. It is responsiveness, the ability to notice, communicate, and adjust rather than assume. That shift can take pressure away from both partners. It turns intimacy from a test you have to pass into something two people discover together. And that brings us to the first major mistake, one that can quietly change the entire experience before physical intimacy even begins. One of the most common mistakes couples can make is also one of the easiest to overlook: rushing. Imagine a couple who have been married for many years. They finally have a little privacy, but they both know it may not last long. Maybe the house is busy, the phone keeps buzzing, or they are simply exhausted after a long day. So they move quickly, hoping to make the most of the moment. Nothing is necessarily wrong. There is affection. There is attraction. But something is missing. One partner may be physically present while mentally still somewhere else, thinking about tomorrow's responsibilities, work, family, or everything that happened during the day. The couple may continue anyway, wondering why the connection does not feel as natural as they hoped. This is where pacing matters. Physical arousal does not always happen instantly. Emotional readiness and physical readiness can also develop at different speeds. Someone may need time to relax before they can become fully engaged. That is not a failure. It is simply part of how human bodies and minds respond. And after 50, this can become even more relevant. Changes in hormones, medications, stress, sleep, health, or physical comfort may influence sexual response. That means trying to recreate exactly what worked years ago may create unnecessary pressure. Rushing can also send an unintended message. Even when a man means well, moving too quickly can make his partner feel that there is a destination she is expected to reach. Slowing down changes that feeling. Think of it like warming up before exercise. You would not expect your body to go from completely still to maximum effort in a few seconds. Intimacy can also benefit from a gradual transition from everyday life into a more relaxed state. And slowing down does not mean making intimacy complicated. It can simply mean giving each other time, paying attention, and removing the pressure to perform. The goal is not to make every moment longer. The goal is to make the moment more connected, but slowing down is only half the story. The next piece is something many men overlook because it doesn't look like foreplay at all. Here is the part that may surprise you. What you bring into intimacy may not be a technique at all. It may be attention. That sounds simple, but attention is different from being present. Being present means you are there. Paying attention means you are noticing what your partner is communicating and allowing that information to guide you. Sometimes the signals are verbal. She may tell you what feels comfortable, what she prefers, or what she would like to change. Sometimes the signals are quieter. Her body may relax, she may become more engaged, or she may seem uncertain or uncomfortable. None of these signs should be treated as a puzzle you have to solve. They are invitations to communicate. And communication does not have to sound clinical. You do not need a long conversation in the middle of an intimate moment. A simple question such as, "Is this comfortable?" or "Do you like this?" can open the door to honest feedback. There is another important point here. Do not assume that yesterday's preference automatically becomes today's preference. Think about food. You might have loved a certain meal 10 years ago, but your tastes can change. Your health can change. Your appetite can change. The same is true of intimacy. Familiarity is valuable, but curiosity keeps a relationship responsive. A good driver provides another useful analogy. Imagine turning the steering wheel once and then refusing to look at the road. It would not matter how carefully you chose that first direction. Roads curve, traffic changes, conditions change. A good driver keeps closely watching and makes small adjustments. Intimacy can work the same way. Responsiveness is not about following instructions perfectly. It is about noticing what is happening and responding with care. That might mean slowing down, changing direction, asking a question, or simply giving your partner more time. And there is something reassuring about this. You do not need to become an expert in every technique. You need to become more attentive to the person you know. For many couples, that shift can reduce pressure and create a stronger sense of teamwork. Instead of asking, "Am I doing everything right?" the question becomes, "Are we both comfortable, connected, and enjoying this?" That is a healthier goal. And once you understand this, another surprising piece falls into place. Sometimes, the biggest obstacle isn't physical at all. It's happening inside the brain. There is another piece of intimacy that is easy to overlook because you cannot see it happening: the brain. We often think of sexual response as something purely physical, but the brain and body are constantly communicating. What you are thinking, feeling, and experiencing emotionally can influence how your body responds. Imagine a woman has had a stressful day. Maybe she is worried about a family member, thinking about finances, dealing with work, or simply exhausted. Her partner may be loving and affectionate, yet her mind may still be racing. That does not necessarily mean she does not love him. It may simply mean her nervous system has not shifted into a relaxed state. Think of the brain like a traffic signal. When a person feels safe, comfortable, and emotionally connected, the signal may gradually move toward go. But when stress, worry, pressure, or fear of judgment enters the picture, the signal can move toward stop. This is one reason telling someone to just relax is rarely helpful. Relaxation cannot always be switched on like a light. If someone feels pressured to respond a certain way, being told to relax can actually create another thing to worry about, and that is where removing pressure becomes so important. Imagine being asked to fall asleep immediately. The more you think, "I have to fall asleep now," the harder it can become. Intimacy can sometimes work in a similar way. When someone feels that they must become aroused, respond quickly, or produce a particular outcome, attention can shift away from connection and toward performance. The solution is not to demand a response. It is to create conditions where both people can feel comfortable enough to respond naturally. That can involve simple things: privacy, patience, affection, respectful communication, and freedom from judgment. For couples over 50, this becomes especially meaningful because life itself can become more complicated with age. Health concerns, medications, sleep problems, caregiving responsibilities, and changes in the body can all affect how someone feels from one day to the next. So if your partner is not immediately interested in intimacy, try not to turn that moment into a verdict about your relationship. Sometimes the body simply needs more time. Sometimes the mind needs less pressure. And sometimes there is an underlying health or emotional issue worth discussing. Understanding that difference can replace frustration with compassion. And this explains something that surprises many men. A partner can love you deeply and still struggle to become interested in intimacy sometimes. One of the most painful misunderstandings in a long-term relationship is assuming that a change in sexual desire automatically means a change in love. It doesn't. A person can deeply love their partner and still have days, weeks, or periods of life when sexual interest is lower. Desire is not a permanent setting. It can rise and fall depending on what is happening in the body, the mind, and the relationship. Think about your own energy. There are days when you wake up feeling motivated and energetic. Other days, even things you normally enjoy feel like work. Sexual desire can be influenced in much the same way. Stress is one factor. Poor sleep is another. Relationship tension, emotional exhaustion, certain medications, health conditions, and hormonal changes can also affect interest in intimacy. And this is particularly important as we get older. Aging does not automatically eliminate sexual desire or intimacy, but it can change the conditions under which desire develops. The body may respond differently. Recovery may take longer. Comfort may become more important. And life may bring responsibilities that simply were not there decades earlier. So, here is a myth worth putting to rest. The myth is, if she isn't immediately interested, she must not be attracted to me. The fact is, sexual interest is influenced by many physical and psychological factors, and one moment does not define an entire relationship. Of course, attraction and relationship problems can sometimes affect desire, but assuming that explanation without talking about it can create a cycle of hurt. One partner feels rejected, the other feels pressured, and neither person explains what is actually happening. A better approach is curiosity. Instead of silently asking, "What's wrong with us?" couples can ask, "Has something changed? How have you been feeling lately? Is there anything making intimacy less comfortable or enjoyable?" That conversation does not need to become an accusation. It can simply be an invitation to understand each other. And sometimes, that understanding is enough to remove a burden that neither partner realized they were carrying. But there is another side to this equation. Physical changes after 50 can make old assumptions about intimacy less reliable. Getting older changes the body. But it does not mean intimacy has to end. After 50, many women experience changes that can affect comfort and sexual response. Menopause is one important example. As estrogen levels change, some women develop vaginal dryness or increased sensitivity and discomfort. These changes can make intimacy feel different from what it did years earlier. And this is where understanding matters. If something feels uncomfortable, the answer should not be just push through it. Pain is a signal worth paying attention to. No partner should feel that discomfort is simply something they are expected to tolerate for the sake of intimacy. There can be other factors too. Certain medications may affect sexual desire or physical response. Health conditions, fatigue, sleep problems, stress, and emotional changes can also influence intimacy. Sometimes, several factors are happening at the same time. Imagine a woman who has been taking a new medication, sleeping poorly, and dealing with ongoing stress. Her partner may notice that intimacy feels different and immediately assume she has lost interest in him. But the real explanation could be much more complicated. This is why communication becomes increasingly important with age. Instead of guessing, couples can talk openly about comfort and changes. A simple conversation can reveal information that neither partner would discover by making assumptions. And there is another important point. Common does not mean untreatable. Some changes are a normal part of aging, but persistent or distressing symptoms deserve attention. If there is ongoing pain, unexplained bleeding, sudden changes, significant discomfort, or symptoms that interfere with daily life or intimacy, it is reasonable to speak with a healthcare professional. A clinician can help determine whether medications, hormonal changes, another health condition, or a separate issue may be contributing. Depending on the cause, there may be appropriate options to improve comfort and quality of life. So the message here is not that something is wrong with your relationship because intimacy changes after 50. The message is that your body may be communicating something new, and listening to it can help. Aging can change intimacy. It does not have to erase it. And remember, these changes are not automatically a reflection of attraction. A woman may want closeness while needing a pace or more attention to physical comfort. That distinction can prevent unnecessary hurt. The goal is not to return the body to age 30. It is to understand the body you have today and care for it. Now let's turn to a mistake that sounds harmless but can completely change the emotional atmosphere between two people. If you want one practical idea to take from this video, make it this. Stop trying to guess what your partner wants and start learning how to ask, listen, and adjust. It sounds simple, but in long-term relationships, assumptions can become automatic. You may think you already know what your partner enjoys because you have been together for 20 or 30 years. Yet familiarity can sometimes make us less curious, not more. A healthier approach begins with a question. Is this comfortable? Do you like this? Would you prefer something different? These questions do not have to sound clinical or awkward. The tone matters. They should feel like invitations, not examinations. The goal is not to demand an answer. It is to show your partner that her comfort and experience genuinely matter to you. Then comes the second step. Listen. This is where many people struggle. They ask for feedback, but when they hear something unexpected, they become defensive. Maybe they think, I've always done it this way, or why didn't you tell me before? Try a different mindset. Feedback is not criticism. It is information. When both partners know they can speak honestly without embarrassment, pressure often decreases. And when pressure decreases, there can be more room for comfort, trust, affection, and genuine connection. Sometimes the most meaningful improvement is simply knowing that both people feel heard, respected, comfortable, and free from pressure in the moment. So remember the formula. Ask, listen, adjust. And once communication improves, couples often discover something else. Intimacy doesn't have to be measured by one particular outcome. There is another habit that can quietly put pressure on both partners. Believing intimacy is successful only when one particular outcome happens. Maybe the goal is orgasm. Maybe it is maintaining an erection. Maybe it is simply making sure everything happens exactly as expected. But when that becomes the scoreboard, intimacy can start feeling like a test, and tests create pressure. Imagine a man who begins an intimate moment thinking, "I have to perform well tonight." Instead of paying attention to his partner, part of his mind is monitoring himself. Is everything working? Is she enjoying this? Am I taking too long? What if something goes wrong? That mental pressure can make it harder to relax and stay connected. The same thing can happen to his partner. She may feel that she is expected to respond in a particular way, quickly enough or strongly enough. Suddenly, two people who wanted closeness are both thinking about whether they are passing a test. There is a better way to look at intimacy. Think about connection rather than performance. Connection can include affection, closeness, laughter, reassurance, touch, pleasure, emotional safety, and simply enjoying being together. A satisfying, intimate relationship does not have to look identical every time. And for men over 50, this is especially important because erectile changes become more common with age. An occasional difficulty does not automatically mean something is seriously wrong. But persistent erectile problems should not simply be dismissed as getting older, because they can sometimes be associated with medications, diabetes, cardiovascular problems, or other health issues. The healthier mindset is not, "I must prove that my body still works exactly as it did at 30. It is, "How can we both feel comfortable, connected, and satisfied with where we are today?" That shift can remove an enormous amount of pressure. Instead of measuring the night by one physical outcome, measure it by whether both people felt respected, heard, comfortable, and close. Sometimes taking the pressure away is exactly what allows intimacy to feel natural again. And if you're wondering what to actually do differently tonight, the next section turns all of this into a practical approach. So what can you actually do differently? Then begin with connection rather than expectation. Talk, laugh, hold each other, share how the day went. A few minutes of genuine emotional connection can help create a very different atmosphere from immediately thinking about what is supposed to happen next. Then communicate about comfort. Some intimate moments may lead to sex. Others may simply involve closeness and affection. Both can have value. At the end, leave your partner feeling cared for, not evaluated. A hug, kind words, or simple reassurance can remind both of you that intimacy is about the relationship, not a performance score. Small changes can create meaningful differences over time. But there are situations where communication alone isn't enough, and recognizing those situations can protect both your health and your relationship. There is one part of this conversation we should never overlook. Sometimes a change in intimacy is not simply about preference, timing, or relationship dynamics. It can be a sign that something deserves medical attention. The key word is persistent. If a woman develops ongoing pain or significant discomfort during intimacy, she should not feel that she simply has to live with it. Vaginal dryness can occur after menopause, but persistent symptoms that interfere with comfort or quality of life are worth discussing with a healthcare professional. The same is true for unexpected bleeding, sudden changes, or symptoms that appear without an obvious explanation. For men, ongoing erectile difficulties deserve attention too. Occasional changes can happen for many reasons, including stress, fatigue, alcohol, or anxiety. But persistent erectile dysfunction can sometimes be associated with conditions affecting blood vessels, metabolism, or cardiovascular health. That does not mean every sexual problem is a warning sign of serious disease. It means sexual function can sometimes provide useful information about overall health. Medications are another piece of the puzzle. Some medicines can influence desire, arousal, or sexual function. If you notice a significant change after starting or changing a medication, don't stop the medication on your own. Talk with the prescribing clinician. There may be alternatives or other ways to address the side effect. And what about a major drop in desire? Again, there is no single normal level of desire. But if a change is persistent, sudden, or causing significant distress, it is reasonable to talk with a healthcare professional. Stress, sleep problems, hormones, medications, relationship difficulties, and health conditions can all play a role. Here is the myth. These problems are simply part of getting old. The fact is that some changes are common with aging, but persistent or troubling symptoms can have treatable causes, so don't panic, but don't ignore persistent problems either. A medical evaluation is not an admission that something is wrong with you. It is simply a way to understand what has changed and what options may be available. By now, the bigger picture should be becoming clear. The secret isn't about knowing one perfect move. So after everything we've discussed, what is the real secret? It is not one technique. It is not a magic touch. And it certainly is not something every woman wants in exactly the same way. The deeper secret is attention. Many women want to feel that their partner is interested in their experience, not simply focused on completing a particular routine. That means noticing comfort, listening to feedback, being patient, and allowing intimacy to develop without unnecessary pressure. Think about what happens when someone feels truly heard in an ordinary conversation. You can usually sense the difference. You feel more comfortable. You open up more. You become less guarded. Intimacy can benefit from that same sense of connection. And this is why listening is not separate from intimacy. Listening is part of intimacy. Instead of thinking, I already know what she wants, think, I want to understand what she needs today. That small change in mindset can transform the experience from performance into partnership. So if there is one message I want you to remember, it is this. The goal isn't to become an expert at performing. It is to become an expert at understanding your partner. You don't need to be perfect. You need to be attentive, patient, curious, and willing to listen. And that gives us a very different definition of what it means to be good at intimacy after 50. Before we finish, let's bring everything together, because the most useful lessons from this conversation are actually quite simple. First, don't assume every woman wants the same thing. There is no universal formula for intimacy. Every person has individual preferences, comfort levels, and experiences. Second, slow down. Physical and emotional readiness do not always happen instantly. Giving each other time can reduce pressure and create more room for connection. Third, pay attention to feedback. Listen to what your partner says, but also notice whether she seems comfortable and engaged. Then, be willing to adjust. Fourth, communicate openly. Instead of expecting your partner to read your mind, ask simple questions. And when she answers, listen without becoming defensive. Fifth, don't confuse desire with love. A temporary change in sexual interest does not automatically mean attraction or affection has disappeared. Stress, sleep, health, medications, hormones, and life circumstances can all influence desire. Sixth, don't make one physical outcome the definition of success. Intimacy is bigger than orgasm, erections, or checking a particular box. Connection, affection, comfort, trust, and mutual enjoyment matter too. And seventh, pay attention to persistent changes. Ongoing pain, unexpected bleeding, significant discomfort, sudden sexual changes, or problems that interfere with quality of life deserve a conversation with a healthcare professional. If you remember only one framework from this entire video, remember this. Ask, listen, adjust, ask what your partner needs. Listen to the answer. Then adjust with patience and respect. First step toward finding an appropriate solution. Most importantly, don't measure your relationship by performance. Measure it by trust, by kindness, by communication, by whether the person beside you feels respected, heard, and cared for. Because getting older is not the end of intimacy. It can be the beginning of a more thoughtful, more comfortable, and more meaningful kind of connection. After 50, intimacy doesn't have to become less meaningful. Sometimes it simply becomes more about understanding the person beside you.